Hi guys, once again, I'm Krissa, co-founder and CEO of Patientory. There are over 117 million Americans living in our country today diagnosed with one or more chronic health conditions that will face problems in receiving their health information. The lack of access to our health information results in increased cost, wasted time, and overall decrease in care. Owning our health information is imperative. It is also important that we share our stories and learn from each other if we're going to improve our healthcare system. Better informed patients are more likely to take better care of themselves, which improves care and guarantees that we are receiving the correct treatment. That's why I started Patientory. Patientory is a service that simply collects your medical information into one platform and connects you to people with similar health issues and concerns so that you always have access to your health information as well as your families. We're based out in Atlanta, Georgia, and that's where my family currently is. All of us right now can picture managing our family's medical records, and it may look like that. I've been managing my family's records for the past 10 years, and we all know it's not an easy task. We recently moved from New York City to Atlanta, and you have to keep in mind that when you change providers and insurance carriers, this adds another layer of difficulty in obtaining those records. Not to mention, our provider is only liable to keep those records on file for 5 years. For example, meet Chris from Atlanta. His 4-year-old son was recently diagnosed with a chronic illness, which meant he had to be seen by over 8 specialists in Atlanta, Cincinnati, and Boston. The insurance company said that over $800,000 of care was spent on Chris's son, which generated thousands of pages in medical records. After waiting 10 months for a request of these records to avoid duplicated tests and no one to turn to, Chris had to actually escalate it up to hospital leadership. So, imagine having access to your health information anywhere you go. You didn't have to rummage through piles of paper, and you have an electronic dashboard that kept you up to date on your health status all in one place. You could also connect with people who share similar health issues and concerns. While this may sound simple, currently only 8% of Americans are registered for a personal health record system, despite the many that are now available on the market, partly because people like me and you have to input this information ourselves. For this reason, Patientory aggregates your information for easy access while keeping your data safe and secure through HIPAA compliance, and through our algorithm connects you to people with similar health issues. We recently launched our beta this week, which focuses on type 1 diabetics and new moms to now engage on the platform. So if you remember Chris, he now has a product that offers the support of a community, and soon his family's medical records at hand. Before the age of social media, we were limited to our doctor or grandmother for healthcare advice. Now, with the click of a button, we have an entire network. Fortunately, the US personal health record market is a growing nascent market with a growth rate of 5.8% since 2010. Overall, the electronic health record industry is a $9.5 billion industry. Since the Affordable Care Act required that all providers electronically store and transmit patient health information, we also see an increase in patients who want to manage and access this information for themselves, especially if they're seeing multiple providers. So people want to learn how to live healthier lifestyles. There are companies out there so after conducting hundreds of interviews and taking into consideration our competition, we found that people not only want to access their health information, they also want to engage. So people like Chris want to share stories that would give them peace of mind. And they're eager to sign up and join. Our revenue model gives our customers this opportunity to use our platform at just $5 a month after trying out for free for 90 days. And there are companies out there like Microsoft HealthVault, HealthSpec, Patients Like Me, and we're better because we're honing in on creating a social network to empower patients to take their health into their hands. And we're also the team to do this. There's myself, a healthcare veteran of 10 years with prior startup success, our full stack developer, Tamel Nash, who has experience building agile software, our front-end developer, Krill Novik, who has experience building mobile apps for companies like Covidian Health and Medtronic, and our advisor, Nigel Waller, who successfully sold his company to BlackBerry in 2014. As I mentioned before, owning our own health information is important, as well as having a community to help us navigate any healthcare issue. With Patientory, you have access to your health information and your family's information, easily accessible anywhere you go. Thank you.